Shine YouTube channel. My name is Ofayo Yobonga. Let me especially appreciate all of my returning subscribers. Thank you for being very consistent. Thank you for your engagement. And to the new subscribers, I'd like you to hop into the train because we promise to bring value-adding content that ranges from lifestyle to healthcare administration, human resource management, fitness, fashion, food blogging, and all you can think of. The goal is just to get you actively engaged through what it truly means to be a healthcare administrator, what it means to be a HR in healthcare, with emphasis to working in the hospital. I have a number of persons who have actually reached out to me in my DM, and then most of them are new in the industry, all right, and then most have been in the industry for a couple of years, but there are varying challenges that comes up with administering a hospital, all right, and part of the challenges has to do with understanding the fact that you have two categories of personnel within healthcare. You have the clinical personnel and you have the administrative personnel. I like to describe the administrative personnel as support staff because indeed the reason why it is called a hospital is because you have the patients that are being attended to. But with the recent upgrade, or with the recent, of course, you know the world keeps changing and evolving. You see that everybody within this umbrella is classified as a healthcare administrator, from the cleaners to the security to the data officers to customer service officers, doctors, nurses, radiographers, and the likes. They are all classified as healthcare workers. Now, being a HR and an administrator in healthcare comes with you working 247, 24/7, right? Now, what it means is that your contract terms might stipulate that you're supposed to work Monday through Friday officially between the hours of 8 to 5 or 8 to 6 as the case may be. But of course, the work goes on even at night because you see, it's a 24 service kind of business. And when patients come up, even though part of what we seek to achieve is to do what? Establish a system that works, and the clinical staff that come together to form the what called healthcare workers comes with a lot. All right, you know, the hospital is predominantly dominated by the clinical staff. All right, and then a lot of times when even some decisions, remember I said there are times where the goal is to build a sustainable system that works even when you're sleeping. Okay, but there are intervals, there are instances where some of these support staff and clinical staff will have to reach out to HR even in the middle of the night. And some of these calls come in as emergencies. There could be clinical emergencies, there could also be administrative emergencies. Yeah, there is something that is called administrative emergency. I think someday I'm going to make a post on what does it truly means to have administrative emergency as a healthcare administrator. Alright, and in situations like that, you see that the HR will be called upon. There are also instances where the patients will directly reach you even in the middle of the night because of course, why not? There's an official line and your number is just there and every patient will try to reach you. But there is a control also that we have tried to put in place, and that control is to make known all the resident official numbers, okay? So such that patients will not have to start calling you in the middle of the night, and to also empower the personnel in terms of decision making. All right. So as a healthcare administrator, you must have some high level of knowledge impact. I know my pastor will always say, that's Pastor Biodun Fatuyibo, will always say the purpose of contact is impact, right? Now, this video is not geared to spirituality, it's geared towards healthcare, but you cannot rule out the fact that as a healthcare administrator, as you must be able to position yourself that you impact on the workforce. And by impact, I mean in the areas of training, learning and development, okay, with emphasis to enabling the workers to take informed decisions, okay, and this will help less the burden on you because truly there is a lot of burden working in healthcare, and one of which comes as stress. That is why I'm number one advocate of work-life balance. If you've been following my YouTube, you see that I do a lot of lifestyle blogging, notification, it comes in forms of nutrition, spa, and the likes. But for you who is just tuning in, you might need to go down and watch all of this video. There's also an aspect of appraisal. Now, very recently, I had an instance where I was talking with some doctors, and of course, in this part of the world, it is an average Nigerian doctor who think that the doctor is not supposed to be appraised. All right, they just have this notion. But then, as a healthcare administrator who also has a background in human resource management, there has to be an integration. There has to be a platform where you know that you will appraise the clinical outcomes. And in appraising the doctors, they're not just looking at clinical outcomes, you're also looking at administrative over functions, okay? Because in the event where, as an admin, you're not scheduled to be on duty, for instance at night, the doctor automatically assumes the role of that, which is why you bring all of this to appraisal, and then the sole aim is to do what? Jig your system. Alright, so part of the challenges that comes with working in healthcare as a healthcare administrator, even though these days is not targeted at a particular industry, particularly in this part of the world, in Nigeria, where I am and where I'm from, it's gradually hitting into all of the industries and the subject of JAPA. Alright, the other time I got a call from a colleague in Lagos who was supposed to access a certain care in a hospital, and then the care was delayed. Okay, I think it spanned for like 3 to 4 hours, and he had called and I requested to know what was the cause of the delay. And the response was a certain doctor who was supposed to have this procedure done was caught up in some other facility. Now that is the impact. And this is something that most patients will not understand. Some of the delays in healthcare as of today is as a result of brain drain. Alright, and an average Nigerian as at now has a mindset of running out of the country, and this is worse in healthcare because there's this general notion that says that as a healthcare worker, once you leave this country, the possibilities of you succeeding, it's actually high. And suffice it to say that there is one of my colleagues that have left and worked in a certain hospital in Abuja for 10 years. And then when he left, he called me that under 1 year, he's been able to achieve the things he couldn't achieve working in Abuja for 10 years. All right, that is not to say that there are no challenges that comes with it, but as a healthcare administrator, this has adversely impacted on what we do. And it is worse now that even from the medical school, you see medical doctors will now want to run away from there. Before now, they want to come, have the NYSC, have their clinical posting and all that, but that's not always the case. Last week I had an encounter with a consultant nephrologist, alright, and we had this discussion, and one of the things he mentioned is that before now, if you want to do residency and then applications or publication is made out there and people come in, you see tons of CVs from doctors with interest on going into residency. But as of today, the numbers are gradually diminishing. And then that will now lead into what? Re-engineering your recruitment process. Alright? Remember, as a healthcare administrator or HR, you have a duty into recruitment. Alright, this has grossly impacted. I recall even in River State, there was a time I was looking for doctors for 6 months and I couldn't get 4 months, I think it was between 4 to 6 months or so. And before this whole Japan syndrome came on board, you could actually walk into the state's NMS office and then you pick up CVs of licensed qualified doctors. But now that's not the case. And then the administrator is at the receiving end. Alright, which is why it's important that while the challenges are there, you should also come up with workable strategies on how to retention. Alright, over the weekend I was telling some patients, I said part of the reasons why some healthcare workers leave this country is not largely because of poor pay, it's also because of the subject of insecurity. Now, a healthcare worker in Nigeria goes through some form of bullying. Alright, some patients will come and they feel that they will talk down on the healthcare workers. Some will even go as far as wanting to assault the healthcare worker, and all of that is beginning to sell ideas into the minds of the healthcare worker to do what? To japa. So you are a healthcare administrator. The things you must put in place to have a smooth process. So having a sustainable system that runs is part of the core of a healthcare administrator. All right, and as much as we agree that there are challenges, okay, if you have a smooth system that works, it has a way of reducing the challenges. There are some of these challenges you just cannot avoid. They are naturally there since you're working in healthcare. All right, but also training the people, getting people to know what you know, so that when you're not there, the system is still running. Having a retention strategy program in place for the healthcare workers. All right, this could come in form of training, sponsoring their projects, sponsoring their conferences and the likes, having a healthy work environment, having safety policies that just protect the right of the patient, but that also protects the right of the healthcare worker is really very important. I hope I've been able to give you an insight into what it truly means to run administer a hospital. Now this is episode 1. As we progress, stay tuned. I'm going to be sharing, I'm going to taking you into a lot of insights, and then to make your process seamless. You're a subscriber, you're watching this video, and you have an interest in becoming a healthcare administrator, please I'd like you to use the comment section. You're watching, you have not subscribed, use the subscribe button, turn on your notification, stay glued, stay tuned. Wafi Shine it is. Love you all.